He began as a doctor, but Jorge Moll didn't stop at healing hearts. He rewired an entire health system. This is the story of a cardiologist from Rio who turned a handful of diagnostic clinics into Rede D'Or São Luiz, Brazil's healthcare empire. A company that redefined private medicine in a country where public and private systems have always tangled. It's the tale of clinical curiosity meeting ruthless entrepreneurial instinct, of converting hotels into hospitals, of deals with global private equity heavyweights, and of a man who quietly moved from stethoscope to shareholder control rooms while keeping research and philanthropy tucked into the same jacket pocket. Jorge Moll Filho was born into mid-20th century Rio de Janeiro, a city of sea, samba, and stark contrast between fancy private clinics and overburdened public hospitals. He trained as a doctor, specializing in cardiology, and like many physicians, he studied the practical with the entrepreneurial. Diagnostic technology, radiology, and labs. In 1977, at about 31 years old, Moll began acquiring diagnostic clinics and labs. Those first moves were humble and surgical, a diagnostic test here, an imaging unit there. But they were the seeds of something larger, a networked approach to diagnosis and care that began to look less like a collection of shops and more like a modular health system. From diagnostics to hospitals, the pivot that changed everything came in a format few would expect: hotels. In the 1990s, Moll purchased the Copa d'Or, a hotel in Copacabana, and converted it into a private hospital. A few years later, he did the same with a hotel in Barra da Tijuca, creating Barra d'Or. The moves were creative, pragmatic answers to space, location, and demand. Repurpose hospitality infrastructure in tourist-friendly neighborhoods into high-end medical centers that catered to paying patients. What started as improvisation became trademark. Moll's group wasn't just building facilities, it was executing a playbook that turned real estate into clinical capacity. Over the next 2 decades, that playbook scaled. Cardiolab, later Labs d'Or, and a string of hospitals consolidated market share in Rio, then branched outward into other major Brazilian states. Moll's strategy mixed reinvestment of profits, targeted acquisitions, and a willingness to partner with institutional investors when the timing called for it. Through the 2000s and 2010s, Rede D'Or began to bundle services: diagnostics, specialized clinics, oncology units, emergency care, under one operating umbrella. That integration allowed the group to offer complex pathways of care internally. A patient could move from imaging to oncology consultation to surgery, all inside the same network. For a private sector patient, the promise was speed, consistency, and convenience. For investors and the company's leadership, it was a scalable, high-margin model built on controlled beds, specialized units, and high-acuity services. Moll's business moves were punctuated by a series of landmark transactions that transformed him from a successful doctor-entrepreneur into a billionaire industrialist. He sold portions of diagnostic assets at the right time, and in the mid-2010s, he struck larger, louder deals. Rede D'Or merged with or acquired rival São Luiz, significantly expanding its footprint into São Paulo and other markets. Strategic capital injections followed, including partnerships with global private equity and Brazilian investment banks that provided the fuel for even faster expansion. As the company scaled, its governance matured. A board with family members and professionals, long-term strategic plans, and publicly visible investor communications. Those choices set Rede D'Or on a path to becoming Brazil's largest private hospital operator. By the late 2010s and into the 2020s, Rede D'Or was no longer a regional player. It was an institutional presence. The group amassed dozens of hospitals, thousands of beds, specialized oncology clinics, and a capacity for millions of outpatient visits and hundreds of thousands of surgeries annually. That scale mattered for 2 reasons. First, it made Rede D'Or a central provider for a swath of Brazil's privately insured population. Second, it turned the company into an asset class attractive to global capital. Private equity firms, big banks, and eventually public investors saw a resilient business with repeatable revenue streams, particularly attractive in an economy where private healthcare often piggybacks on gaps in the public system. The timing of Rede D'Or's biggest public moment, its IPO, was a study in reputation building and capital markets choreography, In December 2020, Rede D'Or went public in one of Brazil's largest health sector listings. The offering drew major international and domestic banks, and it crystallized a valuation that reflected both the company's operating scale and its strategic value to investors betting on Brazil's healthcare demand. The IPO allowed the Moll family and the company to infuse fresh capital into expansion plans, more hospitals, more oncology centers, more infrastructure. It also opened the company to a new level of scrutiny, public reporting, analyst coverage, and greater expectations of transparency. For Jorge Moll, the IPO was the moment the cardiologist's company became a corporate anchor. His story now lived in annual reports and investor decks as much as in hospital wards. Today, Rede D'Or is measured in beds, accreditation flags, and the numbers of facilities under its umbrella. The company proudly notes multiple JCI-accredited hospitals and invests in research centers and teaching programs. Moll's commitment to science and education isn't purely PR. He co-founded IDOR, the D'Or Institute for Research and Education, and later helped start the Science Institute, institutions aiming to pair clinical practice with neuroscience and broader biomedical research. For Moll, whose career began in cardiology and diagnostic medicine, the research agenda is a through line. He values evidence, specialty work, and the institutional scaffolding that lets a hospital be both a business and a knowledge hub. The person at the helm is often described as quietly driven. Moll's background is clinical. He trained in medicine at the Federal University of Rio de Janeiro and built credibility in the medical community before transitioning into full-time business leadership. That clinical credibility matters in healthcare. It gave him entree to medical staff, an understanding of clinical workflows, and the legitimacy needed to expand services that require specialist physicians and complex equipment. Like many physician founders, Moll translated medical authority into executive leverage. He could speak the language of both surgeons and CFOs, which is a rare bilingualism in healthcare leadership. But scaling a private hospital empire in Brazil has not been without critics. The sharp rise of private players like Rede D'Or stokes debate about the balance between public and private health resources, access inequality, and market concentration. Critics argue that giant private networks can drive up costs, attract talent away from public hospitals, and create dependency in regions where private beds become the default for higher quality care. Supporters counter that private investment introduces capacity, technology, and service quality that the public system struggles to finance. Moll's story sits squarely in the center of that socio-political conversation. His company is applauded for innovation and scale, and scrutinized for its market power and influence. These tensions are part of any account of modern healthcare empires. What about money? Various wealth trackers have pegged Jorge Moll's net worth in the billions, reflecting not only the operational earnings of Rede D'Or, but the market valuation of his shareholdings and the stakes of institutional partners. Different outlets give different snapshots. Forbes, Bloomberg, and other indexes have placed him among Brazil's wealthiest individuals, with rankings that rise and fall depending on market valuations, exchange rates, and the timing of share sales or dilution. The headline numbers matter for drama, but what's more important in Moll's trajectory is the economic engine he built, a healthcare platform that converts clinical episodes into recurring revenue streams, attractive to investors who prize scale and predictable occupancy. Jorge Moll's playbook offers several lessons for builders in regulated, mission-driven sectors. First, start from domain expertise. Moll's clinical roots gave him credibility and a deep read on where friction and opportunity lay in patient journeys. Second, be pragmatic about assets. Converting hotels to hospitals is emblematic of opportunistic asset repurposing. Use what's available and adapt it to needs. Third, partner at scale. Moll didn't try to do everything solo. He brought in private equity, regional investors, and later public markets to finance rapid expansion. Fourth, institutionalize research and philanthropy. By supporting institutes like IDOR, Moll tethered his company to science and education in a way that reinforces brand and legitimacy. There are also quieter personal chapters to note. Moll keeps a low public profile relative to his wealth and influence. His leadership style is less celebrity mogul and more reserved chairman, who treats the hospital network as both a family legacy and a national responsibility. Family members appear in governance roles, and the Moll family's footprint is visible across the company's board and philanthropic initiatives. That mix of family stewardship and professional management is common in legacy businesses that transition into public companies. Balancing the founder's cultural imprint with institutional governance becomes an ongoing tension and a management task in itself. Rede D'Or RI, the healthcare landscape Moll helped shape, has been stress-tested by crises, not least the COVID-19 pandemic. Private hospital networks played critical roles in surge capacity, ICU provisioning, and supporting testing and vaccination efforts in many places. For Rede D'Or, pandemic response presented operational challenges and public scrutiny. Questions about access, resource allocation, and pricing bubbled up even as hospitals managed overwhelmed ICUs. How Moll's company managed through pandemic strain is part of the modern record of Rede D'Or. Operational resilience under stress, coupled with debates about the role of private health networks in national emergencies. Looking forward, the narrative doesn't end with buildings and balance sheets. Rede D'Or has invested in specialty clinics, oncology chains, research institutes, and accreditation programs that aim to professionalize and standardize care. The company's stated goals, to expand capacity, raise quality, and integrate care, are the same goals that turn investors' heads. For Moll, the future reads like incremental consolidation, more beds, higher specialization, and deeper penetration into Brazil's health markets. Critically, the governance structures and public listing mean the company is accountable to shareholders, regulators, and patients in ways that the original family-run clinic never was. That accountability shapes decisions, sometimes in tension with the founder's instincts, and that dynamic is part of the modern corporate story. Personal legacies are rarely simple. They're laminated with contradictions. Jorge Moll's life is both a classic rags-to-riches professional arc and a mirror of Brazil's health policy dilemmas. He shows how clinical skill can morph into institutional influence, how one man's strategic gambles, repurposing a hotel, selling a diagnostic arm, inviting private equity, can ripple across a country's healthcare ecosystem. He also exposes the trade-offs of privatized scale, access versus excellence, market logic versus public need, and the uneasy dependence a nation can develop on a handful of private providers when public capacity is strained. Those tensions ensure Moll's story will be told with admiration in some rooms and skepticism in others. If you strip the headlines away, what remains is a portrait of ambition shaped by professional expertise. Jorge Moll took the logic of medicine, diagnosis, specialization, systems thinking, and applied it to organizational growth. He didn't invent private healthcare in Brazil, but he professionalized and consolidated it in a way that few did before him, taking the sector from scattered clinics to integrated networks. His investments in research and education add texture to a public image that might otherwise be reduced to balance sheets and acquisitions. The result is a legacy that's both infrastructural and intellectual, hospitals that function as businesses, and institutions that still attempt to produce science. This is a story that reads like two parallel plots: the clinical practitioner who understood patient flows, and the shrewd executive who understood capital flows. When those lines meet, institutions are born. For Brazil, Rede D'Or is one such institution, a network that will shape medical careers, patient choices, and the sector's economics for decades. For Jorge Moll, the man who once walked corridors with a stethoscope, the transformation is total yet strangely consistent. A lifelong focus on how to diagnose, treat, and improve outcomes, scaled up to an industrial order. In the final balance, biographies reward nuance more than certitude. Jorge Moll's name sits on billionaire lists and board pages, but the more interesting ledger is in beds opened, clinics integrated, research grants funded, and, for better or worse, the ways a private network reshapes demand across a nation. Critics and supporters will both find evidence in his life. That's the hallmark of a consequential figure. He built not just a business, but a system. And systems, once built, have their own gravity. They attract capital, talent, policy attention, and debate. Jorge Moll started as a cardiologist who loved the practice of medicine. He became a builder who loved the architecture of care. Both loves, when combined, changed the face of Brazilian healthcare.